Okay, so what is radio frequency treatment then? During this course, we are going to look at two types of radio frequency treatment. So in this short introduction, I'm just going to explain to you an overview of how they are similar and how they are different. And then as we progress through the course, we'll separate those where relevant to discuss the different literature and treatment protocols, etc., and then pull them back together in places where it's relevant to compare the information to help you to decide on what sort of treatment you'd like to be using or to understand more about the treatment you're already providing. So for those of you that have already studied the pulsed electromagnetic field therapy course, this will look familiar, or even the photobiomodulation course, we covered this as well. So for those of you that do not recognise this, and this is not familiar, because you haven't previously studied those other courses, I've popped a link for you into the classroom for the old lessons that cover this in the original courses, so that you can just go back and gain a deeper understanding of the electromagnetic waves and the electromagnetic spectrum. So you can always just nip back and cover those, or even if you've done this course, or sorry, done the previous courses in the past, and you've maybe forgotten some of that information or just want to refresh your memory, you can always go back and look at this in a bit more depth. But for those of you that have recently studied this and still remember it all, so obviously here we've got an electromagnetic wave. So we know that an electromagnetic wave is produced when a current is sent down a coil or a wire, and out of that current, well, obviously it's also produced in the atmosphere as well, but for this purpose, for using the modalities and equipment that we're talking about, an electrical current is passed down a coil or a wire, and out of that is radiated an electrical field and a magnetic field. And the combination of both of those is the electromagnetic wave, electromagnetic field. And then here we have, which we've looked at before, the electromagnetic spectrum. So in the previous course, we looked at very low frequency, extremely low frequency pulsed electromagnetic fields. So for any of you that want to relate that to equipment, that's equipment like Beamer, FMBS, Respond, Westville, etc. So those types of equipment are right down here, very low on the electromagnetic spectrum, sort of 0 to 200 hertz. So what we're going on to look at now in this course is treatments that are up here in the radio wave area of the electromagnetic spectrum. When this spectrum is from about 3 kilohertz to 300 gigahertz, so a much higher frequency than what we've studied previously. So just having a look then at the two different types of radio frequency treatments that we are going to be looking at in this course. And the reason why we split the courses in this way is that the term pulsed electromagnetic fields, or PMF, and radio frequency, they can get muddled up. And just going back to that electromagnetic spectrum that I've just showed you there, that's why I wanted to separate these out into two separate courses, so that you can understand and so that you can compare equipment and different treatments. Because, you know, if you throw the term pulsed electromagnetic field around, sometimes it covers all of these. Sometimes it covers extremely low fields, it can cover pulse shortwave, and it can become very confusing. So you can't compare one against the other because they're different therapies. They're very similar in many ways, but they're actually different therapies, and also the evidence behind them that backs them up as to what we use to refer for our clinical judgment and our clinical decision making about what protocols to use. Obviously the literature behind them is very different, so you can't translate or extrapolate information from the literature on extremely low pulse electromagnetic fields and go and apply that to radio frequency, because they're not directly transferable. So that's why it's important that we tease out these modalities and we understand the different ways in which they work. So first of all, just looking at pulse shortwave therapy, Originally, there's a lot of history behind pulse shortwave therapy. There's lots of research over many years behind shortwave therapy, and it was originally a lot of the time was used in a constant manner, and it was it was thought that the benefits of the treatment were the thermal aspect of it. And that's what it was always used with, a sort of constant shortwave radio frequency. So there's a lot of evidence and information into constant shortwave. But then with the advent of pulse shortwave, it's now much more favoured in clinic. And the reason why I'm not going into a huge amount of detail on shortwave therapy, constant shortwave therapy, is because we don't use that. So we need to stick with what we're actually using with animals and what equipment that we have that we can actually use. Because originally when the pulse shortwave was first sort of developed and the equipment sort of started to get more sophisticated, it's moved to be much more sophisticated now, particularly for us, so that we can use it in animals. But when it was first sort of around, you would have these monodes or drums, so these huge, loud, clunky machines that were in clinics, very expensive, very heavy, and sometimes they're sort of drums that you would put a portion of your body in, or you would stand very closely to one of these and the radiation would come out and go into your body. So this would be an induction of that radio frequency radiation. So that would be the radio frequency, or the radio wave would come out of that and would be absorbed in the tissues in a similar way that you would expect with extremely low frequency pulse electromagnetic fields. So nothing to be seen, just a radiation that would be absorbed by the body to make some physiological changes. So that was never really appropriate for animals. There was not really a way we could use that equipment in veterinary practice. What that has gone on to look more like now, which is absolutely great because it's something that we can now use for animals. So it's all very well these therapies being, well researched and, known to have clinical benefits, but if we can't actually use them for animals, then it's useless for us. So now these have been developed, or these or similar. So what this is a continuous coil loop, and you will have the radio frequency electromagnetic wave in the middle of this coil. So again, very similar to pulse electromagnetic fields, where you have coils and the energy radiates out of that and is absorbed by the tissue. So this is by induction, so nothing has to touch. As long as the body part is inside the loop or underneath the loop, then the treatment will penetrate into the tissues from that coil. So again, nothing to be seen, but that electromagnetic wave, a radio frequency, a radio wave placed on the spectrum, that wave will actually absorb into the tissues and bring about those clinical benefits that we want to see. So that will be your pulsed shortwave therapy. So when we discuss pulse shortwave therapy in this course, we are considering this type of device currently, because that's what we mostly use, and that's what we're looking at by induction. So over here we have something quite different. And this is actually, although it's comes under radio frequency treatment, it's quite different because it's actually using the electrical current is actually going into the tissue. So rather than a wave that is being pushed out into the air and then being picked up by the tissues or traveling into the tissues, this is actually the electrical current. So it's radio frequency electrical current that correspond to the radio frequency, the hertz of radio frequency on the electromagnetic spectrum. An electrode needs to be in contact with the skin, and there needs to be some sort of conductive gel or creams used to make the connection. Similarly, in that way to ultrasound, the way we would use a conductive gel there. these lower frequency currents will not travel through the air and just go into the tissue. They need to be connected, and that's why we use the conductive gel. And also what's very different about this type of treatment as well, can't be seen in this picture, but you'll see it further on in the course, is that you actually have, this is actually a monopolar treatment. And what that means is that you have a return plate. Obviously there's a horse in this picture. For horses, the return plate is normally on the sternum. So you have a closed circuit and you have a return plate. So from the electrode that you use here to the return plate, there has to be a connection made. And what that is quite exciting, especially with horses, is what that means is that we can get a deeper penetration into the tissues. So that's very exciting. But that monopolar treatment is quite unique to this type of radio frequency electrical currents. So just to summarize on that then, the pulsed shortwave treatments that we're looking at are in the range, or all the research that we're looking at are at 27.12 megahertz. So that's where they are on the electromagnetic spectrum. That's the frequency of them. The radio frequency electrical currents that we'll be looking at are at 448 kilohertz. Those will always be the specific frequencies used. And for this type of treatment, it's a pulsed shortwave treatment and it's delivered by induction. And for this type of treatment, it's a radio frequency electrical current therapy, and that's obviously delivered by a current to the tissues. So that's the difference, the main difference of those radio frequency treatments. But sometimes they'll just be shown as one thing or talked about as one thing as radio frequency treatments. So you can see they're quite different with their delivery, with their frequency and what they can do. So it's important that we identify or we differentiate between them. So just finally then, what I've already just discussed, what is very exciting now about these treatments, now that we have equipment that we can actually use for animals, is that we now have some way of getting some deeper penetration, it seems. So when we look at laser therapy, or photobiomodulation, or even then pulse shortwave will go a bit deeper. So laser therapy is superficial in comparison to these types of treatments, has very good benefits for the skin and sort of the more superficial structures. But if we're looking over here at the radio frequency electrical currents, because we have the monopolar connection, the closed circuit connection, we can actually draw that energy much deeper into the tissues, which is very exciting for particularly for equines, because we have very deep structures on equines, such as the sacroiliac joint and places like that, that previously we've really only been able to hope we can reach, but in reality we probably weren't able to reach with electrophysical agents. Whereas it's seeming much more likely that we are able to reach them with these radio frequency electrical currents. So that's just an introduction to the two types of radio frequency treatments that we will be covering in this course. In this lesson, you have now got some follow-up reading and a quiz, and then we'll move on to separate out the two types of treatments and look at them individually.